Everyone right to go? Yep. Thanks very much for being here. I'll run through the numbers of the day quickly and then a little bit of background and context of the roadmap, and then I'm going to take you through at a fairly high level the key features of the roadmap, Victoria's roadmap to deliver the national plan. First of all, there were 507 new cases yesterday. All were locally acquired. 282 of those cases are in households with an existing case. There are now 5,262 active cases across Victoria. Sadly, one man in his 90s from Moreland has passed away, and we extend our best wishes and our sympathies to his family. 84% of cases were aged under 50. There are 204 people in hospital with COVID-19. 55 of those are in ICU. 38 of those are on a ventilator. Of those cases who were in hospital yesterday, 87% were not vaccinated. Only 1% were fully vaccinated. Vaccines work. They protect you. The vast, vast majority of vaccinated people are protected against serious illness and protected against finding themselves in an intensive care unit. There's every reason to get vaccinated, and that's why it's so pleasing that 43,441 vaccines were administered yesterday, and even more importantly, 43,963 appointments were made yesterday. This is really ramping up now. We've pushed through the 70% first dose barrier. We're approaching the 45% double dose barrier. There's still a way to go, and as we talk about those milestones, 70% double dosed and 80% double dosed, which are key markers in the national plan and key features of Victoria's roadmap to deliver the national plan, that'll yet again provide another reason to get vaccinated, not just your health and the health of others, but being able to see these rules change, being able to end lockdowns, open up and get back to something approaching normal. I should also just thank all of those who went and got tested yesterday. Some 58,619 test results were provided to us overnight. I thank that nearly 60,000 people who got tested yesterday. It's so critical to us keeping numbers lower than they otherwise would be. That takes pressure off our nurses. That makes this still challenging, but it makes it far less difficult than if people don't come forward to get tested. We thank them for making that contribution to our pandemic fight. Now, just on vaccination, before I move to just some background and some context about the roadmap, there are 9,076 first dose Pfizer appointments available this week. There are about 5,000 first dose AstraZeneca appointments available this week also, so that haven't been taken up yet. There's no sense of criticism in this, but I have to say, Friday, National Cabinet was told that there are some issues with just exactly how much Pfizer is coming in October. There's an issue with the order. I'm sure that the Commonwealth Government are working very hard to try and resolve that, but I think it's a bit uncertain exactly how much Pfizer is going to come to our country and, of course, to our state next month. That's another reason. Go and book an AstraZeneca appointment today. They're available. They're there for you. We work through a process. You'll get to sit with a senior health professional, talk you through all those issues. You can make an informed choice, and you can get the vaccine that will protect you and that is available right now. I don't know how much Pfizer is going to be coming next month. I do know that we have more than enough AstraZeneca. People just need to make an appointment. Of course, this week, with community pharmacy really ramping up their efforts, the Moderna vaccine will be available. And I'd encourage people to either go to your trusted community pharmacy, and the Guild have done a fantastic job in rolling this out and making sure that their members are ready. Go to your trusted GP or come to a very busy and very efficient and very effective state-run hub. There's more than 55 of them across the state, as well as pop-ups in all manner of different places. Book with confidence, turn up and protect yourself and all of us. Now, in terms of the roadmap to deliver the national plan, the last 20 months have been all about buying us time to get the community vaccinated. We know that there will be a pandemic of the unvaccinated. If we open everything up now with just 45% of people double dosed, then we would have a catastrophic number of people who would be very, very ill. Many, many thousands of people would be in intensive care, and that is not what success looks like. If, however, we open steadily, gradually, but open, as we get to 70 and 80% double dosed, then our nurses, our doctors, our ambos, they'll come under intense pressure. It will be incredibly difficult in our health system, but we'll be able to pass through a gateway, an important gateway. We'll be able to normalise this. We cannot perennially suppress or permanently suppress this virus. Lockdowns have been about buying time to get to 70 and 80% vaccinated. We are fast approaching those milestones. At that point, we have got to open the place up, because remaining closed forever has its own cost in every sense of that word. So this is a very difficult balancing act. The reason I make these comments is that Burnett Institute, have done an amazing job for us, worked with us very closely last year and this year, and the roadmap to deliver the national plan that I'm announcing today is well informed by the Burnett modelling. It is, however, modelling. It makes assumptions. It assumes things that will happen and won't happen over a period of time. I want to make it very clear to all Victorians, particularly to those who are working in our health system, that as we deliver this roadmap, we will monitor every hour of every day. How many people are in hospital? How much pressure is there on our health system? Are we balancing that? Are we able to continue to provide the best care to everyone who needs it? There is going to be some very difficult days and weeks, perhaps longer, in our health system. I have nothing but respect and absolute admiration for those who work in our health system. We will stand with you, we will support you, and we will monitor very closely what the impact of this inevitable opening up, this absolutely essential opening up, we will monitor that impact on you, on your patients, on our health system. That will be a very difficult balance to strike. I thank the Burnett, but it's sobering, and I think it's important. We've released to you and through you to the Victorian community the complete Burnett modelling today. No redactions, no omissions. You have every page, every word. It does make for sobering reading. It indicates, and again I stress, it is assumed. These are assumptions, and I'll come to how we'll get a more accurate picture in just one moment. It assumes, and it models out, and it projects that on or about the 15th of December, cases will peak at about 4,500. Toward the end of December, admissions to hospital will peak at about 3,150. And in January, deaths due to COVID-19 and the Delta variant will peak at around 2,200. These are sobering numbers. The notion of opening this place up really quickly at 70% or 60% or today, that simply cannot be done. We can deliver the national plan. I've just come off the phone with the Prime Minister and assured him that we are doing exactly that. It'll be done in a staggered and measured and proportionate, a cautious way. But we are opening up, be in no doubt about that. And there will be no turning back. We have got to normalise this. We have got to pass through and pass beyond this pandemic. Vaccination is critically important. 80% is critically important, but we won't stop at 80%. We will continue to urge people and indeed to require some people to get vaccinated, to drive that number as high as we can possibly drive it. Every person that's vaccinated is one less person who will finish up gravely ill in hospital. It's one less patient that nurses have to do double shifts to treat and care for. Everyone out there can play a part in coming forward and booking an appointment and becoming part of that growing number of people who are protected by a vaccine. Now, I've said it's modelling. It's a forecast. It's not based on actuals, or at least it's based on actuals to this day. It can only predict the future. You can't know that. I would just say that we of course, wish everybody around the country, particularly our friends in New South Wales, we wish them all the best. But just as they learnt from our outbreak last year, our second wave, we will have an opportunity to monitor and learn from theirs. They are, because of vaccine prioritisation, they are a few weeks ahead of us. They will open before we do, because they will reach 70% double-dosed and 80% double-dosed ahead of us. We will be able to, and we work very closely with our colleagues and friends in New South Wales, to know and understand what the virus is doing there. But we will, all of us as Victorians, and indeed the rest of the country, will look on and very keenly observe and watch and monitor exactly what happens in New South Wales when they open. They begin their roadmap process at 70% and indeed beyond that. What I'm saying is, modelling is important, it informs you, but it doesn't write the plan. You have to update it, you have to take actual numbers and replace your assumptions with actual data. We will do that, we will refine things, we will consistently update this roadmap, and I just stress there will be a lot of questions to come out of this. There'll be a lot of deep engagement with industry, with all sorts of different people from across the community in this week and indeed beyond. These are not public health orders. They're not being signed into law today. This is an aspirational, but I think a realistic plan to get our state open, to cope with the inevitable surge in cases, and to see us put this global pandemic behind us as best we can. There is time, in other words, to go through detail, to add to this, and to answer all your questions today and indeed beyond. I will be back before you tomorrow, and I know that we'll follow up on any of the individual or sort of more localised questions that you may have. Now, what is it that we're going to do over these next few months? Firstly, when we reach 80% single dose, people will remember just a few days ago I made announcements about 70% single dose, picnics and some things of that nature. Once we reach 80% single dose, which is on or about the 26th of September, so not many days away at all, Melburnians will be able to go outside to catch up with friends and be involved in some of the outdoor activity that they have longed and craved and really missed for a long time over these last 2 years. For instance, you can play basketball, golf, tennis, cricket and other outdoor recreational activities, but the same limits on households and numbers will apply with picnics. This is really important. It means that people can get back to doing the things that they love the most, things that are really passionate for them, a big part of their life. But it's got to be done safe, and there will be venue to venue, activity to activity, rules and COVID-safe plans. And I know that people so desperate to get back to these things will take those rules seriously and make those activities as safe as possible. Personal training will resume for up to 5 fully vaccinated people outside. For regional Victoria, at that same milestone, on or about the 26th of September, masks can be removed. This is for hair and beauty. Masks can be removed for your entire booking at the hairdressers or at the facility where you're getting beauty and personal services. In education, final years VCAL students can return to on-site learning. Now, schools, and this is the first, it's significant, but it's the first and not the last piece of the schools plan. The Deputy Premier will be out in just a few days' time to talk about airflow, filtration, ventilation, things we're doing to make classrooms safe. He'll talk about all manner of different elements and fill in some of the detail beyond what I'm about to say today. But for Melbourne, from the 5th of October, that's an indicative date. We believe we'll be able to deliver that, but on or about the 5th of October, and that'll firm up in coming weeks. Students in Melbourne, students can return to sit the GAT, if that's required, on the 5th of October. From the 6th of October, on-site learning for VCE Units 3 and 4, and final year VCAL and IB students. They'll be back in the classroom. From the 18th of October, prep students return 3 days a week. Grade 1 and Grade 2 students return 2 days a week. So it's staggered, it's balanced, and it's about limiting the spread of this virus. Schools involve a lot of movement. Lots of kids, lots of parents, lots of teachers and staff. Lots of movement to and from. But this is how we're going to do it, a staggered reopening. It'll look different, but they'll be back in the classroom. At 70% double dose, the indicative date being the 26th of October, so that's phase B of the national plan. So what I just mentioned was the 5th and 6th of October. Now jumping ahead to the 26th of October, when we believe we'll be at 70% of 16 and over will have had not one jab but 2. The following will apply. The lockdown will end. Reasons to leave the home and the curfew will no longer be in place. So lockdown will be off. 10 fully vaccinated people will be able to gather outdoors. Physical recreation and community sport training will come back for minimum numbers of people. There'll be rules and structures around that, but it'll be back again. May look a bit different, but it will be back. The lockdown will be over. Pubs, clubs and entertainment venues can open to 50 fully vaccinated people, but it has to be outdoors. In this 70 to 80 phase, there is a massive priority toward outdoor activity because that is so much safer than indoors. It won't be what everyone wants to hear, it won't be what everyone wants to do, but it's what's possible, it's what's safe, and it's what we're announcing today. Pubs, clubs and entertainment venues, 50 fully vaccinated Victorians outside. That's at the 70% mark, double dosed, on or about the 26th of October. Weddings and funerals will be open for 50 fully vaccinated people, again, outdoors. In terms of schools and education, all school students will return to on-site learning at least part of that learning week. At least some of their week will be for all students in the classroom face-to-face. There'll be further details provided and exactly the sequencing and how that works in the intervening period. We do have some time before the 26th of October. Hairdressing and personal care open for up to 5 fully vaccinated people, but that can be done inside. It's rather impractical for much of that to be done outside. That's Metro. For regional Victoria, once we get to that 70% double dosed on or about the 26th of October. Social and recreational, community sport returns indoors. There'll be requirements on minimum and maximum numbers. Pubs, clubs and entertainment venues are open indoors for not the 10 but for 30 patrons. They'll have to be fully vaccinated though. In education, all school students return to on-site learning at least part of the learning week. So essentially the same principle as Metropolitan Melbourne. There may be some variance school to school, but the same principle. All students back for at least some of the learning week each week at that point. For faith gatherings, funerals and weddings, they're also allowed 30 people indoors and 100 people outdoors. Now, having passed through the 70% double dose toward the end of October, we will then, on or about the 5th of November, we will reach 80% double dose. That is we won't say that's the end, it's not. We're going to keep pushing people to get vaccinated, but that's the really important, and that is under the national plan, that's the maximum level of vaccination protection. 80% double dosed. In the plan, I mean. That's our ultimate end point. At that mark, regional Victoria and metropolitan Melbourne will be on the same set of rules. There'll no longer be differences between the two. There'll be one set of rules for the whole state. To run you through the highlights of what that will look like. Up to 10 people, including dependents, will be allowed to visit your home. Up to 150 fully vaccinated people can dine indoors, and up to 30 can gather in public outside. Indoor community sport will be open. There'll be, again, requirements around numbers and things, but it will be open. Masks will only be required inside. Pubs, restaurants and cafes can open for seated service only, up to 150 fully vaccinated patrons inside and up to 500 patients outside. 500 patrons outside. 150 inside, 500 outside. From a work point of view, work from home if you can, but you can go to work if you are fully vaccinated. Hairdressing, beauty, personal care will be open for fully vaccinated people. Retail, all retail will be open. From an education point of view, early childhood education and childcare will be open fully. All students return to school with additional safety measures in place, and we aim to have that return to school as close to a normal pre-COVID, fully open school environment. As I said before, the Deputy Premier will be out in a few days' time to talk about airflow, ventilation, filtration, some of the other things we've done to make our school environments as safe as they can be. Things we've done and things we will do in the intervening period. On-site adult education returns for fully vaccinated Victorians as well. Weddings, funerals and religious services return for 150 fully vaccinated people indoors and 500 people outdoors. Now, there is then a gap between when we achieve 80% double dose and a number of very key moments for all of us, one way or the other. Whether it's New Year, the end of the working year, the middle of summer, Christmas, however you want to frame it. We aim to have 30 visitors to your home on Christmas Day. We aim to also deal with the consequences and deal with whatever we need to do around other decisions that the Commonwealth Government will make in that post-80% double dose framework. International travel will happen. I hope that interstate travel can happen. There will be a number of green lane countries or travel bubbles where people will be able to freely move between their country and therefore into our state. We will deliver all of that. We will deliver whatever the national plan determines fits within that time frame. A lot of that work has not yet been done. We have tried to predict out and plan and give people certainty as far out as we can, but trying to predict what things look like to great detail in January and February and beyond is a little bit challenging. Of course, with the passage of time, as weeks and months go by and we get closer to that 80% number, we'll be able to give people greater certainty about what 2022 looks like. But as a kind of bookend at the end of the year, this roadmap is predicated, and we're going to work as hard as we can. Our plan and our hope is to deliver 30 people in your home on Christmas Day. That is to say, Christmas as it was last year. Christmas as close to normal as possible. That's something that's very, very important. That is essentially the list of highlights. There's a lot more in the roadmap than that, but that is the list of highlights as I had committed to take you through. I know you'll have lots of questions. I'm going to ask Martin to speak a little bit about a number of issues, including some epidemiology and some difficult decisions we've had to make in regional Victoria. Then the Chief Health Officer can speak to his advice, to where he sees things, and of course any other comments he wants to make, and then we'll take your questions. This is Victoria's roadmap to deliver the national plan. We will do so faithfully, cautiously, but make no mistake, we are opening this place up. There is no alternative. There is a gateway here. It will be challenging, but we must pass through it. We cannot have a perpetual suppression of this virus. No one's arguing that, but I'm just making the point. There will be pain. It will be challenging. It will be very hard on our amazing nurses and doctors and ambos and the whole team in our hospitals. We'll support them. We'll stand with them. If you care about nurses and doctors and ambos, cooks and cleaners, everybody in our health system, if they're important to you, then get vaccinated. Make an appointment today. Turn up and play your part in certainly not making the job of our health professionals harder. There is no modelling I have seen and no plan that I have seen that a Victorian would look at and say that's a plan to open up that does not involve acute stress in our health system. That is the nature of the Delta variant. This is unavoidable, but we have to manage it as best we can. In anticipation of the amazing work that our health professionals will do, I say thank you and I give you my commitment. We will stand with you so that you can stand with your patients and provide them the very best care that Victorians are well known for and that Victorians are right to expect. These are not orders. They are our hopes, they are our aspirations, and we will work as hard as we possibly can, and we hope the community joins with us to deliver the national plan through this Victorian roadmap. And the biggest and most important part of that is getting vaccinated. It'll keep you out of ICU and it'll get our state open sooner. Please get vaccinated today. Over to you, Minister.
Thank you, Premier. So while we have our part to deliver on the national plan, guiding us over the next little while so as to get open safely, and until such time as all Victorians who are eligible get vaccinated, we need to make sure that we take a very strong and very fast public health actions in accordance with the national plan when the epidemiological talk says we have to, when the evidence says we have to get on top of outbreaks. And that's why it's so important that when the Commonwealth announced there would be more GPs and pharmacies coming online over recent weeks, starting next week, that is so important to get more vaccines into our primary care providers, to get more points of availability, to get more vaccines into the arms of Victorians. So I take the opportunity to really encourage everyone to get vaccinated as soon as you can. And you can do this increasingly by checking for appointments, as I say, particularly with GPs and pharmacies, as more supply gets to them. You can also come to our more than 55 plus all the pop-up state-run clinics to make sure that you can get in and out quickly and safely, whether it be for AstraZeneca or Pfizer, subject to the Commonwealth making it clear what we're getting next month. And that's to avoid the kind of opportunities and the kind of devastation that we can see when the virus gets into families and communities. And we want to avoid that. That's why the national plan also is predicated on where you have to have localised, short, sharp lockdowns to avoid that devastation. Which is why the Chief Health Officer has advised us that we need to take such strong, fast, short, sharp action in the following 3 local government areas. The City of Greater Geelong, the Surf Coast Shire and Mitchell Shire will all enter into a 7-day lockdown from 11:59pm tonight. The rules in these 3 LGAs will be the same as they are in Melbourne and Ballarat at the moment, minus the curfew. There will be 6 reasons to leave home in these areas. Necessary goods and services, shopping, everything you need, 1 person from that household once a day. Care and compassionate caregiving reasons, including medical care and getting a vaccination or a COVID test. And the 3rd will be authorised work and permitted education. The 4th will be exercise. The 5th is outdoor social interaction. And as I say, the 6th is getting a COVID-19 vaccine. As a result of the changes in Metro Melbourne, once we hit the 70% single dose, the 4 hours a day for exercise and other social interaction applies as well as do the other recent changes where you can have 4 others join you if they are fully vaccinated. Otherwise, it's just the 1 person from another household if you're not vaccinated. The authorised worker system will be back in place for these LGAs. You'll need a permit. If you can work from home, you must work from home. And the onus is on your employer to ensure that that happens. But the most important message in all of that, so as to make it short and sharp and make sure that it's no more than 7 days and with a bit of luck less than 7 days, is to get tested and to get vaccinated. Regional Victorians know what the show is here. They've overcome emerging outbreaks before. We've seen it in Shepparton several times. We've seen it in Mildura. We've seen it in Colac. I hope we're seeing it right now in Ballarat, which is doing an extraordinary job. And I'm sure we will see it in Geelong, in the Surf Coast and Mitchell Shire local government areas. And the public health teams, together with the local public health units and local governments and local civic groups, will be, are right now, engaging with local communities, local health services, to establish more testing and more support to make sure that we use this as an opportunity to drive ahead of the virus spread in those local government areas and get those communities back to being as open as they possibly can be and as safe as they possibly can be. Just very briefly on the wider outbreak in Metro Melbourne. The same patterns that we've seen over the course of the last period continue. The predominance of the virus continues to be in the north and western suburbs of Melbourne. We've seen 158 cases in Hume, 67 in Whittlesea, 40 in Moreland and 47 in Wyndham. There is again a continued growth in the southeastern suburbs, with now 16 cases in Casey, 14 in Greater Dandenong and 9 in Cardinia. Just back to the regions, and we've just seen 1 case in Ballarat, and that was a workplace contact of a known case. We've also seen 1 case in Bass Coast, a household contact of a worker related to a construction site. In the Surf Coast and Greater Geelong, we've seen 4. We've seen 2 in Geelong, a worker from Melbourne, and a household contact of a separate construction worker. And in the Surf Coast, in addition to all the other cases that have been bubbling along there, we've seen new cases linked to trades and construction. We are still seeing repeat wastewater detections in Aireys Inlet with no obvious source of that case. In the Mitchell Shire, in addition to the cases that have been showing up over the last few days, yesterday we saw 7 cases. 4 are linked to trades and construction work, and 3 are household contacts of those different 4 cases. I just finish on one particularly sensitive outbreak. We've done extraordinarily well in aged care since the mandate for testing and vaccinations has come in, and now, of course, after Friday, it is compulsory that all workers either be vaccinated or have a confirmed vaccine time before the 1st of October. And we've seen a few outbreaks in staff, but it's being contained away from residents. At the Meadow Heights Aged Care Facility, we have 1 staff member and 2 residents test positive yesterday. One of those residents is in hospital, and another one of those residents is transferring to hospital today. The good news is that 94 of those staff were fully vaccinated, 2 doses, and 77% of the residents were fully vaccinated. There also continue to be a number of spot fires in construction sites around Melbourne and regional Victoria relating to COVID outbreaks. We continue to monitor those, but can I urge everyone to keep an eye on the exposure site lists that constantly get updated, and as the Premier has, the most important thing you do is to get vaccinated, to support yourself, to support your family, your community, our hard-working public health and hospital workers, and make sure that we get down to that pathway of delivering the national plan and getting open and staying open. I might ask the Chief Health Officer to add some detail.
Thank you, Minister. Just on the roadmap, it really is our pathway out of here. Clearly, it's got some indicative signposts on the way. I think they provide hope. It is a long path still, but it is absolutely right to consider it our home stretch. We would all like to already be at the settings that might apply for Christmas, to see our friends and family overseas, to be able to gather in large groups. But there's a long haul in front of us, and there is a lot of work that we still need to do collectively to make sure that we protect ourselves, protect each other through that pathway. It remains a tightrope between ensuring that our health system is not overwhelmed, but also being able to sustain us in our well-being and to protect us from those other harms that come from lockdown. That is no easy pathway to take, but it is based on the best of modelling that we've received and the best evidence that we've got available to us. We will continue to review the epidemiology day by day to see what adjustments can be made in that roadmap. We might do better in some areas. We might need to hold in others. We'll make those decisions at those junctures as public health directions are getting written down. But we should feel hopeful about some of the really important changes that will come in coming days. People might rightly ask, why are we opening up anything before 80% double dose? Well, there is an issue of our well-being, and I've been asked many times on it, and we all need to reflect on that. There are challenges every step of the way in lockdown, and we need to bear in mind how people sustain the behaviours that need to be sustained, how people are challenged by their social isolation and by not doing those things that they love, and we need to be able to support people on that slow and steady pathway to opening up. That does mean that for those lowest risk activities, we should make those available to people to support their well-being. and also to ensure that they are focusing their attention and their behaviours in those areas that are lowest risk. So those interactions with other people happening outdoors, happening amongst fully vaccinated individuals, and happening with the lowest risk of transmission to others. That gets people out of not complying with the really important bits about not seeing people within homes, not interacting in a way that really drives the numbers in this epidemic. We are in a once-in-a-century public health crisis, so there is no easy pathway here. I've said it all along. There are only difficult choices to make, but I think the roadmap provides for that awful but balanced tightrope between really difficult positions. But we should feel hopeful about the things that are coming in weeks and months ahead. Some other changes, just on New South Wales, there will be some changes to our border settings from 11:59 p.m. tonight. The 66 local government areas plus Jervis Bay, which are not locked down currently in New South Wales, will be downgraded from extreme risk zones to red zones. That means that Victorian residents have an entitlement to apply for a red zone permit and an entitlement to return to Victoria. They'll have to quarantine at home for 14 days and get tested at regular intervals through that 14-day period. But you can't have been in one of those remaining extreme risk zones, so those LGAs under lockdown in New South Wales in the previous 14 days before you travel. It'll also have impacts on the New South Wales-Victoria border. Before this outbreak in New South Wales, people living in the border community could cross the border for any reason without a permit. That changed when the entirety of New South Wales became an extreme risk zone, and people in the border community had to obtain a cross-border community extreme risk zone permit to cross back and forth. Now, for all but one cross-border local government area, which will be they'll be downgraded from an extreme risk zone to a red zone. That's all of the cross-border area apart from Albury, which is, of course, in lockdown at the moment. So if you live in that cross-border area, and if you haven't left in the previous 14 days or been in Albury in the previous 14 days, then you can enter Victoria without a permit for any reason from tomorrow. The usual disclaimers stand. You can't have COVID, you can't be a primary close contact, you can't have symptoms, and you can't have been to an exposure site. If that applies, you really shouldn't be travelling at all. You should be in quarantine or should be getting tested and isolating until you have your result. That's it from me. I'll hand back to the Premier. Thank you.
Thanks, Brett. Just before I go to questions, I neglected to mention that at the 80% single dose mark, so we hope that this will be around the 26th of September, so not too far away at all. Not only will there be that expanded opportunity for the recreational activity, that outdoor recreational activity, but also the distance you can travel from home will be extended for all lawful purposes, not just for the rec, but for all lawful purposes, from 10 to 15 kilometres. I'm not sure if I mentioned that when I went through the table. Happy to take any and all questions, and if I can't answer them, somebody else on the podium may be able to, and if they can't, we'll come back to you, because we do have some time. None of these changes are being made tomorrow. It is a roadmap, but an enormous amount of work has gone into this, and I want to thank the Chief Health Officer, the Public Health team, the Department of Health team, and all the staff and others, the colleagues who've worked very, very hard to put this before you today. In many respects, though, there's even more hard work to be done now as we deliver it, and as we fill in some of the gaps and provide further and further information. There'll be an enormous number of roundtables and consultations, lots of conversations this week to make this real. A plan is important, of course, but you've got to then turn it into actual outcomes on the ground.
Premier, just with the push towards mandatory vaccinations,
yes.
What other areas would you mandate? I know you've talked about this.
Sure.
But what areas will you do it in?
I think it needs to be we need to be very careful here. It's no small thing to mandate that a class of person or a group of people who attend a certain venue have to be first and second dosed. Mandatory vaccination is no small thing. We don't have a reticence. We're going to get this done in a number of areas. But there is a process for the Chief Health Officer to go through to look carefully and make a proportionate decision. We did see some ultimately frivolous legal challenges last year. I don't want to invite those again. But I'll tell you what we've done, and that gives you a sense of where we're headed. We, as a National Cabinet and as a nation, frontline healthcare workers, aged care workers, regardless of whether they're in the public sector or the private sector, and I can report, some Victorians may not have necessarily picked up on this on Friday, but we received a report on Friday at our National Cabinet meeting that something like 98% of aged care workers across the country have received their first dose. That's the power of mandating this. People work to deadlines. People will, that sense of they're not opposed to getting it, they just haven't got around to doing it. It brings some urgency to this task. And nothing's more urgent than getting vaccinated, because that's how we stay safe and that's how we open up. So we've done aged care, we've done frontline healthcare workers, construction, and we've also had some changes. We made some changes in relation to the freight industry. I would make the point, and I preface it by saying this will not be my legal determination under an Act of Parliament. It'll be for the Chief Health Officer to do this. But for instance, if I'm going to stand here and say the only people that can go to the pub, those 150 inside and 500 outside, once we get past 80% double dosed, if you're going to deny people entry on the basis of their vaccination status, well, we won't want, the person standing ordering a beer has to be vaccinated. Well, the person pouring the beer will have to be vaccinated too. Logic tells you that. But the legals of that, the instrument that actually delivers that, is a matter for the Chief Health Officer. We will this week and next week, I think, pretty well over the next couple of weeks, we will, the Chief Health Officer will go through that process, properly determine and balance up and make a properly legally defendable decision under the Act about which groups of people will have to be mandatorily vaccinated, will have to get themselves vaccinated in order to go to work. We'll announce those as they happen, sector by sector, and then people will be able to move through that process. Again, I wish I could with absolute clarity give you a long-form list right now, Rich, but we have seen some people who've gone off to court and they didn't win, but I don't want to be inviting that. It needs to be done in a proper way. So stay tuned. There'll be several further announcements this week and next week about different groups in the economy and in the community that will need to get vaccinated by a certain date. It'll be a reasonable timeline, but it's very important in terms of driving down the risk of transmission, giving our nurses a fighting chance, and not actually promoting the spread of this.
But I guess given you've got October 26, all kids are back in the classroom, could we expect that teachers...
Yeah, I didn't put teachers on the list, but I think you can safely assume that is one of the sectors that the Chief Health Officer will look at very, very carefully. Same for childcare. Of those authorised workers who are moving around the economy right now, there's about 1 million of them. So I don't have 1 million doses of vaccine just sitting there right now unless everybody took Pfizer. Sorry, everybody took Astra. Supply gets better over time. We've also got... You can't just vaccinate 1 million people in, a week. The system is very big, but it needs to be managed. So we do have some time to settle these issues. We will, and as soon as we can provide each and every one of those workers, each and every one of those families, with certainty about what's expected of them, we will. I could give you a list right now of who I think might finish up in that category, but that may well mean that someone takes us to court and tries to challenge that, and I don't think that's something that we should do.
Mandatory vaccines for patrons, for example,
yes,
to hospitality venues or wedding guests, funeral guests.
Yep.
What rights will businesses have to be able to enforce mandatory vaccination? And I know it still hasn't been drafted. What kind of penalties are people looking at potentially?
That's not yet determined. What we will do is we will, from a business point of view, the business will be required to only have vaccinated people on their premises. So it's not that they're not having to impose something as a business. It is, in fact, it'll be a determination of the state government via public health orders, again, made by the Chief Health Officer with all the tests and processes that he has to go through so that those orders are legally safe. But that's what will happen. And so the business is simply doing what they're required to do under state law, and that is to only allow vaccinated patrons. In terms of penalties, we haven't quite worked that through yet. No, it is a little way off. And the other thing too is other ministers will have more to say this week about a series of trials that we're very close to being able to announce where those trials will be. There's also going to be a series of grants that will be announced, particularly for regional Victoria and Metro Melbourne as well, A bit like you remember last year we did the outdoor hospo grants where people could transform spaces and turn them into outdoor drinking and dining spaces. There are many other spaces that now, with the move to outdoor activity in the main, in that 70 to 80 phase, those grants will support that as well. So on many different fronts, today is the frame, if you like. A bit more than that really, but then there will be further infill, further detail that will be provided over time.
There's been talk of vaccine passports at a national level.
Yeah, sorry, the third point was the trials are in fact to test the Commonwealth database of who's been vaccinated, the Australian Immunisation Registry, the AIR database, with our Services Victoria app, so they can talk to each other, not to retain any information. There's no privacy issues here. We're not going to keep a record of who's vaccinated. We don't have that. It'll just be the two things aligned, the QR code and the person's been vaxxed. So you'll get a green tick, and the venue operator will be able to know that you are one of the 150 vaccinated people that he or she is allowed to have inside once we get past 80% double dosed, or the 500 people they're allowed to have outside once we get 80% double dosed.
So what do you do about businesses that, for example, there's hairdressers and beauty here that can only open to 5 vaccinated people? What happens if that business owner choose to operate and service anyone, vaccinated or unvaccinated?
Yeah, that's not quite worked through, and we do have a little bit of time to do that, and I would hope that people would know and understand that the last thing we want to be doing is promoting the spread of this virus. So, for instance, the vaccinated economy is not yet operating in regional Victoria. Regional Victoria and the economy is to a degree open. We're not insisting on people being vaccinated or not, and frankly, we've only got about 45% of people are double dosed now. So we need that extra time to get the numbers up. Otherwise, you're really asking, you're asking people to do something that they physically can't because they haven't had a chance to be vaccinated yet. But we are, as the Prime Minister has noted, we are fast approaching. I don't quite agree with him when he says we're there now. I think we've got a little way to go, but we're fast approaching a situation where those who want to get vaccinated have had an opportunity to do so. I've been very clear that we're not locking the place down when we get to 80%, indeed 70%, because we're not going to lock down the whole state or the whole of Metro Melbourne to protect people who have chosen not to protect themselves. Right now, I think there's people who want to get vaccinated who haven't been, is the point I'm making, Chanel. That changes soon, and that's when you start saying, okay, well, now that we've got to the 80 mark or 70, let's start having the economy open for vaccinated people because it's safer. Unvaccinated people, they're the ones who are going to get really sick. They're the ones who are going to be in hospital. They're the ones who will also be at greater risk of getting and spreading this. That's why it's there. It's nothing more than that. Would be my hope that 100% of people get vaccinated without us having to do these things. But just like aged care, sometimes you've got to give people, a series of reasons to do certain things. And I think these are powerful motivations. Be safe, be well, be open, and be able to do the stuff that you love. Get vaccinated.
At what stage are we bringing in vaccine passports, given that a lot of this is hinging on people being vaccinated to get these freedoms?
Where the table talks about things opening and predicated on vaccination status, that's when we will have that vaccination passport ready to go, and that's when you'll have to check in, if you like, and you won't just be QR coding to determine and place on record that you were in a space. It'll also be confirming that you are eligible to be in that space because you have been double dosed. Really good discussion on Friday at National Cabinet about that. Minister Pearson in our government, Minister Dominello in the New South Wales government, and I think Minister Robert in the national government, they're all working together. The technology, any technology can be quite challenging, but I am assured that they're making good progress. It's a relatively simple thing to have the two databases, if you like, or the database speak to the app. At the same time, there will be some people in the community who don't have a smartphone or don't necessarily have a technological way of, they won't be able to electronically or digitally sign in. There will be provision for them to have a piece of paper that has their name and their details, and it demonstrates that they have been double dosed.
So that's by 70% double dose?
Yes, that's where the very first of those vaccinated economy thresholds kick in, and it'll certainly be a feature by 80, as you can see with the 150 and 500, just as one example in pubs and restaurants.
And will those passports be a permanent fixture?
So that's for Julie.
Thank you. Will those passports be a permanent fixture or just temporary?
I don't think they'll be permanent. We don't have a passport for the flu, for instance, each year, even though we have a community vaccination program and we encourage people to get their flu shots. Part of normalising this, part of moving through this very, very difficult gateway, but move through it we must, is we have to try and balance it out. We have to try and get our freedom back, get the place open, but give our nurses a fighting chance to be able to care for the inevitable people who will get very, very sick. These sorts of passports are designed to do exactly that. They won't be there forever. I can't say, as I stand here right now, how long it'll be on, how long it'll be a feature of things. But, you know, arguably, it won't be a vaccine passport you'll be showing in the first half of next year. It'll be your booster passport to show that you've been to have your third jab and that you've still got the protection that comes from either AstraZeneca, Moderna or Pfizer.
Premier, is it correct that childcare won't go back for everyone until November 5th? And will parents have to be vaccinated if they want to send their child to
There's no determination on vaccination status of parents. If that were to happen, that'll be part of that process I alluded to before. And I realise it's difficult that we can't provide a list of mandatory vaccination and our expectations in every single group. But if we did that, that would not necessarily stand. It would not necessarily be upheld. That's the nature of the Public Health Act. And frankly, that's what you want. You want the Chief Health Officer to sit and carefully consider each of these matters, not just do some blanket thing. In terms of free open childcare, so back to normal, I don't have the document in front of me. We'll absolutely come back to you. It's I think it's a progression. I'm not exactly sure on the date you've given me, but I'm happy to come back to you.
Premier, is the government able to, I guess, reduce the time between intervals of vaccination, particularly for Pfizer, move from that 6 to 3 to speed this up?
I've got no advice to do that. We have changed the interval between first and second doses for AstraZeneca, and that was very similar. In fact, it's exactly what's happened in New South Wales as well. It's an option, but I've got no advice to do it, and I just would make this point. Again, I'm not offering a medical opinion, I'm not a doctor, but the advice I have to this point, no dose, obviously zero protection. First dose you get to about 70%. Then you complete the protection with the second dose. So there's more gain for all of us as we suppress this virus in more people being first dosed than potentially having, at the expense of first dose protection, more people completing their course. I do understand though there is a trade-off there, because the national cabinet national plan is about 70% double and 80% double. I think what will happen, just as we have reached our first dose targets ahead of schedule, I think we may well reach our second dose targets ahead of schedule. But my only concern, and again, it's not a criticism, it's just a fact. I think there's been lots of coverage of this over the weekend. It was certainly noted at National Cabinet on Friday that there might be some issues with the Pfizer order for October. Let's hope that gets resolved really quickly, and I'd be confident that the federal government will be working hard to do that. But if in doubt, like I know I've got a first dose AstraZeneca for you and a second dose AstraZeneca for you. I know that coming mid this week, at least by say Wednesday, General Frewen made it clear to us on Friday as well that there's a lot of Moderna going into our community pharmacies, and there'll be first and second dose. So don't wait for something that may not arrive. Get the vaccine that's there today. And that at the moment, that's one. That's the Astra is the only other alternative. But come, Tuesday, Wednesday, Thursday this week, there's going to be a Moderna alternative as well. And the efficacy of that, it's approved, it works. It's a fantastic expansion of the Commonwealth's program.
Are you concerned that we won't? I mean, looking overseas, I think the UK is at 66% double dosed, Canada 70%, US is below that.
Sure.
Is 80% achievable?
I think it is absolutely achievable.
Is there a contingency if we don't get there by these dates?
No. Let's be very clear about this. Logic tells me, we're fast approaching 80. We're going to get to 80, and I think we'll probably get there before we have forecast here today. If you go, once you've had one shot, the vast majority, there's a tiny number of people who don't complete their course. So the key threshold here for us is once you get 80 plus first dose, then I think we can be very confident, certain almost, that we'll get to 80% double. But we can't stop at 80%. The national plan has to have a number in it, otherwise it wouldn't mean much. It says 80, but we won't stop at 80. We're 80, then we'll add in the 12-year-olds, the 12, 13, 14 and 15-year-olds who aren't counted in the 80 but are now eligible because they became eligible later. Then there'll be 81, 82, 83. Every single person that's double dose protected is one less person who will finish up in hospital gravely ill. That's what the numbers tell us. That's what the numbers tell us.
Can we ask the Chase something?
So we will get there, Rich. Yeah, of course you can. Absolutely. Or Martin, or
Can I
or not.
Can you
Yeah, you go first, then.
Premier, if that's
Sure.
okay? We have projections on when we're hitting 70% single dose, 80% single
Yep.
dose, etc. Obviously, Hume at the moment, it's the epicentre of the coronavirus outbreak.
Yes.
A couple of days ago, their first dose vaccination rate had increased from 40.8% to 55%. So it was a 34% increase compared to the
Yes.
week before. Do
Yep.
we have any projections on when they're likely to hit 70% double dose and 80% double dose?
Not that I have in front of me, but I'm happy to come back to you if we've got LGA specific. That's about the smallest unit of measurement that the Commonwealth breaks it down to. There can sometimes be a bit of a lag in that data, but let me see what we've got, and if we can provide you with further information. I would just say I thank the people of the north and of the west, where there are the majority of cases, but I would just say that this hasn't happened by accident. We've opened extra sites, we're pushing hard through all of our community networks, trusted voices, we're doing pop-ups, we're doing all sorts of things, and that's, I think, probably one of the contributing factors. Plus, with cases and with hospitalisations and with people seeing those they love ill and locked away for 14 days at home, that really drives people going and playing their part. We've seen that in Sydney, we've seen it through all of our outbreaks. We've got a job of work to do, though, in those suburbs and in every suburb, because I just want to stress for people, like, first dose, we're doing really well. I reckon we'll get to 80% before the calendar says we will. Let's hope so. We certainly did. We smashed the 70 by three or four days. The million doses that we predicted, we were early on that too. The point here is, though, we're only at about 45% double dosed right now. So we've still got a fair way to go. And there's a big difference in terms of the number of people who get really, really sick between 45% double dosed and 80% double dosed. And that'll be an average. Some will be higher, some will be lower. You make a good point. We've got to focus on those suburbs, and we are. And the good news is that those suburbs, those families are focused on getting vaccinated, and we're seeing them come out in really strong numbers.
We're only a couple of weeks away from essentially reaching the 70% double dose. Are you
Yep.
confident that in a place like Hume or Brimbank, Wyndham, Melton, they're obviously disproportionately affected by the virus?
Yes.
And once we begin to open up, cases will disproportionately again be higher there. Is there anything more we can do to speed up the vaccine process in those suburbs?
Yep, there is, and we'll have more to say about that. I think it'll be probably taking some things we've already done and taking them to a new level. I don't think there's some kind of magic wand thing that we haven't done yet, but the more people that are compulsory, that it's not really a choice, that obviously helps. Pop-ups, things of that nature. The other thing too is that without getting into quite an interesting discussion, but probably not great TV, the notion of the modelling doesn't necessarily see where the cases are now stay well ahead of where the cases will be once you open up. You finish up over time with a relatively consistent distribution. What the best defence against that is having as uniform vaccination coverage as possible. So it's a mathematical exercise. But you're right, they're a bit behind now. We've got to push them up. We've got lots of different ways in which we can do that.
Can you explain why the extra... Step 4 is November the 5th. Cup Day is November 2. Do you think we can reopen for Cup Day with the 80%?
I want to get to 80% by Melbourne Cup Day. And we'll probably prevail upon our friends in racing and others, and we might well have a bit more to say and frame the thing together and make it part of a bit of a campaign, a push. It is the race that stops the nation. I want it to be held in as normal circumstances as possible, but 80% is the marker that opens our state. So the two things we may well be out there and link the two quite a lot. I can't say that there'll be crowds there, but we're working with all sorts of different partners on all sorts of different things. 70% and 80% are incredibly important markers. We can't be certain when we're going to meet them, but it'd be great to think that we had it done before then, and that perhaps we can have a crowd of vaccinated people, double vaccinated people. But again, it's too early for us to say that today. But we'll have many more options in delivering. If we deliver 80 by Cup Day, or it's really clear that we're going to, well then we'll have options to have a crowd there. I can't say how big and all of that, and no one, I don't think, would reasonably expect me to. We've got to get there, but it's a great goal, and the two things happening at about the same time. We should make that a strength. It'd be a great signal to the world, great signal to the rest of the country that Victoria's open and that we're back in that leading role. Major events capital, sporting capital, racing capital for those who are taken by that sport of kings.
Pfizer doses. Some states are giving those Pfizer doses to over 60s.
Yes, we aren't.
Would you like, given that there may be an issue with the order of Pfizer doses, should those states hand over their Pfizer doses to the over 60s to Victoria and New South Wales, who haven't had that?
No. The answer is no. Look, I say with the greatest of respect to people that are over 60, you've got a perfectly good vaccine that works for you. It's called the AstraZeneca vaccine. You should go and talk to your doctor, your pharmacist, because Moderna's going to be available. That's another option now. You don't need Pfizer. You don't need to take... I don't know anyone in their 60s who's a grandparent who would take something off their grandchild. If you're in your 60s and you're taking a Pfizer shot, you are essentially taking something off a 12, 13, 14-year-old. Because the only vaccine they can get is Pfizer. We're not going to be making those changes. I wish other states well in what they're doing. That's fine. They're in a different position. They haven't got an outbreak. So all the stuff I've been talking to Samaya about, the urgency and the traffic that's driven by having cases, I'm not critical of Mark or Anastasia or whoever's done that. We won't be doing that. And I think people that are in their 60s and older, they understand that they've got a job to do to protect themselves and to protect everyone. They've got a perfectly good vaccine. There'll be exceptions to that for history and medical reasons. That's why. Don't listen, don't be guided, don't get medical advice from anybody other than your doctor, your pharmacist, or a nurse vaccinator at a state clinic. Make an informed choice, but for heaven's sake, take the vaccine that's available today. Don't wait a month, don't wait a week, because it may not be there. It simply may not arrive.
What's the gap between the Moderna doses? Is that 3 weeks? Or is
It's a good question, actually. 4 weeks, I'm reliably informed by the Chief Health Officer, who I think is about to be summoned to the stage to answer all sorts of other questions.
I was going to ask something. I could ask you and the Cho.
It's dangerous.
There's a different narrative right now, and I think in hindsight's 2020. But you are saying that you're taking broader advice. You're looking at all various sectors of the economy, people, society. It's really dystopic out there. I mean, in hindsight, would you have not prepared the health system last year rather than going for zero for this kind of eventuality? I mean, that was kind of the discussion last year. Initially, we were about preparing the health system for it, and then we went for zero. Do you think there's I know hindsight's 2020, but do you think there's a gap in there? In that?
No, I think it's really important to understand that we were never going for zero. We were actively, aggressively suppressing the virus. Victorians did such a good job of that we did get days of zero. Then Delta comes along, very different world. Almost a brand new virus. The attack rates, or the speed at which it infects people, how seriously unwell they get when they get Delta, all of those things. It's a very different fight we're in. Zero was a byproduct of the amazing sacrifice and work that Victorians did. The strategy's always been about suppressing this. Other countries in the world have got a different strategy, but we've always been consistent here, and I think all states have been. As it stands now, you've got a number of states that have zero, but they won't be at zero forever. They're going to have to... It is almost inevitable, the experts tell me anyway, I'm sure they're telling them too, that the Delta will get in. And then they'll have to do what we've done so many times. They'll have to track and trace, they'll have to isolate people, they'll have to drive their testing right up, all of those things.
You seem to be taking broader advice right now than last year, though.
I would just make a point. We've always taken very, very broad advice, and we've always had on the table the maximum number of inputs, whether it's mental health, viability of business, the viability of the health system, frankly, the number of funerals that we're going to have. All of these things have to be factored in. But we've got now the thing we've been waiting for, the thing we've been buying time for, the thing we've been stalling for, the vaccination coverage is about to be here. It'll be here faster, and more importantly, it'll work better if more people get vaccinated. There are appointments. There absolutely are. Please go online and book one. But I would say our approach is exactly the same. Our approach hasn't changed. What's changed is that now we have to call time on this. When we get to 80 plus, that's as good as it's going to get to make that leap, to pass through that gateway, as hard as that will be.
The New
South Wales Premier has said that she wants to reopen travel between New South Wales and Victoria once both states reach the 70% double dose target. You've essentially ruled that out. At what stage do you believe it will be reopening to New South Wales?
Well, a couple of points. We've got a border bubble. Slightly confused at the moment and complicated because Albury's in a lockdown and Wodonga isn't. Secondly, we have some people from that border bubble that have come home and sort of proved up our systems. We have got the red zone declarations as opposed to the extreme zone declarations for all the non-lockdown parts of New South Wales. So those people, which will be hundreds and perhaps thousands of people, will now be able to get a permit and come home. The next group I'm focused on, we'll have more to say about this later in the week, are the thousands of people who are Victorians who are in that extreme zone. They're in Sydney proper. We want to get them back. I can't have them all come back on one day, but I want to have thousands of them come back, you know, every few weeks there's 1,000, and then the next 1,000. That's what we're aiming for. There'll be some technology used in that, or maybe not, depends on case numbers. The fourth point, or the fourth group, is those who want to travel more broadly, back and forth. I want that to be able to happen as soon as possible. That will not be occurring at 70%, and that's not a big disagreement or a point of argument. I understand what Gladys wants to achieve there. I've got no advice that should achieve it. That should occur at that point. At 80%, though, I think we have many, many more options, and in that post 80% period, which is referred to there, the national plan. And this Victorian roadmap is about delivering the national plan and being faithful to it. Us playing our part nationally, that's all about a freedom of movement, both internationally as well as interstate. I want that freedom of movement as soon as we can, including having the international borders open. But that isn't a matter for me.
Will you commit to reopening Victoria to New South Wales at that point?
I'll commit to following the advice of the Chief Health Officer on what's safe to do. But my commitment is to have that open as soon as I possibly can.
Is there a chance international travel could be on before we reopen to New South Wales?
I would certainly hope not, and I don't think that wide-scale kind of, across-the-board international travel would happen before then. We've got a bubble with New Zealand that's been suspended at the moment, or green lanes, as the Prime Minister and the federal government talk about. I think we're going to finish up with other countries that are due to join that bubble, but I don't think it's going to be a free-for-all where everybody from any part of the world can come here. I'm going to wait and listen to those announcements when the federal government make them, but I think that'll be based on vaccination status and all those sorts of things.
Can you explain this?
Sorry, you've said at a previous press conference that you think there's a possibility we could be closed to New South Wales until next year. Has your thinking changed on that?
No, all I'm saying is we need to double check. We need to be cautious. We need to make sure that we're not doing anything that will make the job of Victorian nurses and doctors harder. I know it deeply inconveniences people. We've got to get people home, and we've got a good, strong plan to do that, and we'll have more to say about that this week. Beyond that, we need to move around the country. Of course we do, and we'll get that happening as soon as we can safely do it. I don't know exactly which. I remember saying it. I don't know exactly what day I said it. I don't know what the case numbers were in Victoria that day compared to New South Wales. But we're in very similar circumstances now as what New South Wales is, and that, just to be frank, that gives you options. That if we've only got a handful of cases, then you couldn't open up to a jurisdiction that's got thousands.
Why won't you commit to a reopening to New
Because
South Wales
frankly,
if we have
Julia, with the greatest of
international
respect, interstate travel is not at the top of my list.
But if we have international travel happening at the end of the year, why are we not prioritising opening to other
But you're putting a
states
hypothetical to me. That's by no means certain. That's by no means certain. I don't know whether we're going to have international travel by the end of the year. I think that's the aim, and I think that probably will happen, but I don't know it as a certainty. I don't know from which countries people will be coming. I don't think it'll be from the entire world. We'll get the New South Wales border open as soon as we can. Others have closed to us, and I've never quibbled with that. I've never found fault with that. They're acting on advice, I'm acting on advice. That advice will change when it's safe to do so, and we'll get the place open for international travel, and for interstate travel. But I would just say, repatriating Victorians is high on my priority list, on my list. But interstate travel is not at the top of my list. Getting the pubs, businesses open, getting our economy going, getting people back at work, that's much more important, can I say, than people travelling from Melbourne to Sydney and Sydney to Melbourne.
And just on that point, under your roadmap, when we get to 80% full dose coverage, there are still density limits and
Yep.
you know, serious caps on indoor venues.
Yes.
When do you think we'll be able to move to an era where there aren't any density limits? For
Look, to be honest, we don't know, and we could try and forecast out into post-Christmas, well into 2022. We would be guessing. The accuracy of modelling becomes like it kind of degrades over time, because you really are assumptions on assumptions on assumptions. Once we get to 80%, and once we deal with the immediate aftermath of having opened up pretty well fully, like nothing's closed at 80% pretty much. There's a lot of limits on things, but the place is open. And hopefully that includes the New South Wales Victorian border, and to Tassie, and to South Australia, and to Queensland, and I'm not even going to put WA on the list, but everyone else probably.
Should we not
The issue is, though, when we do get to that point, and we, rather than modelling, we can actually see how many patients are in beds, how many people are sick, how we're coping, how many nurses we're having to ask to do doubles, then we'll be able to answer the really important question. I know why people ask it now, but I can't answer it now. But I will be able to, though.
And is there a possibility? Obviously, the National Cabinet plan is to open up at 70% and then 80%.
Yep.
If our healthcare system is under such serious pressure, is there a possibility that we might not be able to do the things that we're hoping to be able to do?
So as you see at the bottom of the documentation we've given you today, these are not health orders. They are a plan. These are what we hope to do. These are our aspirations. It's not a wish list though. Like, it's off evidence. It's a lot of hard work gone into it. A lot of hard work. And I thank all the people who've done all that behind the scenes work. But, there are various safety valves here. If our health system is asked to perform an impossible task, we won't ask them to do that. It's going to get very tough though, and they know that. They absolutely know it. It was tough last year. This is going to be even harder. But at 80% double dose, there will never be a better time, as hard as it'll be. There is no better time than to move through that gateway and move beyond this.
Can you spell out when gyms will open and what people, can they be vaccinated, unvaccinated, what will happen with gyms?
Not right now, but I will. I'll get someone to, unless Martin or Brett can do that. No, we'll come back to you.
But do they open under 80%?
Once we get to 80%, then yes, they do. Exactly how and what density limits and things, I haven't got that in front of me. That wasn't in my highlight. It'll be in your long form document that you've been given, I think. We will help. We'll find it for you.
The burnout modelling and
Yes.
our restrictions don't necessarily line up. The
Correct.
burnout modelling points to around 2,500 hospital beds as being the sort of limit.
Yep.
So once we get to 80%, how many patients could we handle in hospital before those alarms are triggered?
So, couple of points. Right off the top, I think I made the point that there is no modelling that can be done on a document that if I handed it to just an ordinary hard-working Victorian in the street and said, "What's that?" There's no way they'd read it and say, "Yeah, that's a plan to open." It'd be a plan to stay closed, or it'd be it'd take so long to open that it might as well be a plan to stay closed. So to do what we said, which is open up, there is risk, and there is certainty that there will be many people who become very unwell. Truth of the matter is, Mark, we don't know. We can't be certain until we've got actual data, not just assumptions. Our modellers are great people. They're very, very smart. They do amazing work. But they'll freely concede to you.
I appreciate it,
that
but it's not a question of modelling. It's a question of capacity in our hospital system to keep elective surgery open. How many COVID patients?
By the time you get 2,500 patients, we will have had to make significant changes to elective surgery.
So that's why I'm asking where are those benchmarks?
And what I'm getting to, perhaps long-windedly, I'll try and be more direct. I can't tell you definitively what 2,500 patients in our hospital system will mean, because there's a lot of variation. How many of those are ventilated? How many of those are on an ECMO machine? How many of those are in a high dependency unit bed? How many of those are in a general surgical bed? There's so much variation. How long are they staying for? This is the other thing with Delta. We've got people who the length of stay is going up as well. So it's not just about numbers, it's also qualitative. But at 2,500 patients, 3,000, that number, that is an incredibly difficult very, very difficult, and in some respects an unrecognisable health system.
should the
We have to try and
general
avoid that. And that's why I keep banging on about go and get vaccinated, because there's nobody who's got vaccinated who is in one of those beds. Or if it is, it's a tiny percentage.
I suppose the question is, at what is the earliest point of hospital admissions for COVID patients, whether it be 1,000 or 500 or 1,500, before you get to that 2,500 mark, where in a post-80% world, you may impose further restrictions? What
So you mean take a step backwards or,
Yes.
or pause?
Yes.
Both?
Well, post-80%,
Sure.
you'd assume
No, well,
everything goes in.
post 80%, so just to be clear, in a post 80% world, there are some things we can be certain of right now, and there are some things that we're going to have to wait until we're closer to 80%. And we've had 3 or 4 weeks of Sydney being open. Again, I wish them well. We don't want them, we want them to do well, right? They learnt from us last year. We are in this position where we will be able to not look at modelling, but look at actuals. What actually happens in New South Wales hospitals when they take the steps they foreshadowed at 70. We'll be able to watch that and understand it and trawl through all that data. And the teams will work together to do that. I know it's frustrating. It's a perfectly good question. It's very difficult to answer right now. We need to be closer to that as a reality, not as a forecast or a model, to be certain. Our aim would be, perhaps, at different points we have to pause. Our aim would be to avoid, by doing everything we can, having to go backwards. That is our aim.
I guess the question is,
I can't be more definitive than that.
but with the government in charge of our hospital system,
Yes.
surge workforces and everything else, obviously you can do things both ways. You can either restrict the movements of the public or pause them, or boost our hospital system. So I'm just wondering, where is the line?
Yeah, but hang on. Well, what I'm saying to you is, and I'm not forecasting this, but it may be the case that you have to do both. It may be the reason I talked about the burnout stuff off the top, and you were given it hours ago to look through, because it makes for sobering reading. This is a hopeful document. It's informed by the modelling, but the modellers didn't write this, and that would be unfair to ask them to write it because they're making assumptions. It's our job to write the plan, and that's exactly what we've done. It's well informed by the modelling, and you've got all the modelling in front of you. What we can't know now, but what we can be more certain of in weeks and months to come, is exactly how wildly does the virus spread. How many people get sick, how many are admitted. But it is absolutely possible that 2, 3 plus thousand patients are in hospital, and we have to fundamentally change the way we deliver health services. The doctors' union will tell you this, the nurses' union will tell you this, any clinician will tell you this. That's a big number. They don't have to be in ICU to create enormous amounts of stress in our system. We've only got so many nurses, we've only got so many doctors, we've only got so many, skilled people to do this important work. And they're pretty busy regardless of COVID. So that stress is going to be there. We've got to do everything we can so they're not overwhelmed, but it's going to be tough, but we're going to do everything we can so they're not overwhelmed, and then deliver all these gateways as we move through this plan. If we have to pause, it would only be for the very best of reasons. And what that would be, for instance, is that our hospitals are overwhelmed and our nurses are being asked to do superhuman things. They're pretty special people, but we have to give them a fair fight. I know it's frustrating that I can't, with absolute certainty, map out every day for the rest of September, October and November. I wish I could do that. I can't. The modelling informs us. Actuals every day. Every day that goes past, we've got real, not what we think will happen, but the actual numbers. We input those. Bernard are going to keep working with us. They're going to keep running and rerunning. And then we've got to see what happens. And hopefully, more people have got vaccinated than we thought were going to get vaccinated. The people are following the rules. They're being diligent. They're working hard to make sure the job of our nurses isn't made even more difficult. That's an amazing motivation. It's an amazing motivation. I think people will rise to that challenge. So hopefully, some of these predictions are on the pessimistic side. We just have to assume that that's what happens, and that's why there's caveats all over these documents, and it's why I'm being frank with you. If I get advice to pause because people will unnecessarily die, then we will do that. But that's not our aim. Our aim is to deliver what is before you.
So what happens to elective surgery at
Sorry?
this stage? When we experience the projected spike in COVID cases in December...
Some of it would be moved to the private system, for instance. We have a national partnership agreement. We're very grateful. At that point, Julia, it's no longer two health systems. It's one health system, public and private, working together to get through this very difficult time. I've been a health minister. Health ministers are all about doing more elective surgery, not cancelling elective surgery. It's a very difficult decision to make. But I just say to every parent, to every person across Victoria, there's an important principle in public health. The sickest patients get treated quickest. That's what everyone needs. It's what everyone wants. Because you can, through no fault of your own, become one of those sickest patients and find yourself in ICU when you never thought you would need to be. And if all those beds are full of COVID patients, those beds will not be available to you or your loved ones.
Have you had discussions with the Prime Minister about at what point in that roadmap we're no longer a hotspot? Because that will obviously turn off payments for people.
It's a good point. No, I've not had that discussion, but I will be having those discussions, and I expect that. So the hotspot declarations made by Professor Kelly, with support from others. We've got certainty around business support and income support for a period of time, and Martin Pakula made announcements and the Treasurer's made announcements about that. I might get them to chase that up for you. We won't know, but if your question is when are we assuming, I haven't turned my mind to that. Others have though, and I'll try and get them to come back to you.
Just on the burnout modelling again,
yep.
It is based on an estimate that we'll have 1,400 to 2,900 cases by mid to late October. Over the last couple of days, we have seen our rec number coming down.
Yes.
We're seeing a stabilisation in Sydney, where they're a bit further along in vaccination. Is it a bit too pessimistic, and is there perhaps scope to reopen more quickly than the roadmap lays
I
out?
absolutely hope so. I absolutely hope so. But when you and all the factors that you point to are absolutely right. New South Wales has stabilised, and you could argue that it's starting to come down. Certainly in their LGAs of concern, although they've had a couple of challenging days the last couple of days where they've had to maybe take a little bit of a sideways step at least. Look, I hope that the best modelling in the world, I hope that it is not as accurate this year as it was last year. These are the same people who did the roadmap last year, and they pretty well got it right to the case and the day. I hope that they are more conservative. In some respects, there's a few more variables now. Like closing down, you're either open or you close. It's quite binary. This is about opening up, so there's many more vagaries, many more variables. Modelling gets better the more times you run the simulations and the more real data you have, as opposed to trying to guess and predict what reality will be. That's frustrating because everyone wants the answer today, not in 2 or 3 weeks when the model is better. But we'll keep running it, and we'll keep updating you.
If there are fewer cases than are modelled by the time we say reach 70%, would you perhaps introduce some things at 70% that you had been planning to hold off to until 80%?
I think we'd have the discussion, and the discussion would go something like this. I'd ask the public health team and the hospitals team, could we maybe do this? What do you think? And then they'll either say yes or no. And the things they'll consider is, well, is this good management or is it good fortune? Because we do know that good luck does play a part in this. Can we be confident that the success we've had and the unders that we're seeing are going to hold? Or does it explode quite quickly? And would, by those bring forwards, we ourselves be making a difficult situation even worse? Like even right now, and this is no commentary on our staff, and it's no commentary on resources. We provide more resources to our health system than any government in the history of our state. There's pressure and strain in our health system right now with a couple of hundred patients. So even if you were lower than Burnett's, even their median, let alone their worst forecast, that won't be an easy day on any ward in any hospital. That'll be really, really tough.
When cases peak in December, and
Yep.
if the government believes that our health system isn't coping properly, is there a chance that we'll be put back into lockdown?
We're going to do everything we can to avoid that. I think this was Rachel's question before. There's always a chance that you can do things faster. There's always a risk that you have to pause, and there is ultimately. I can't stand here with any certainty and say that we might not have to take a backward step. But we're all working as hard as we can, and Victorians can join us in that. There already are the sacrifices that are being made, but in a kind of positive sense, going and getting vaccinated, reaching our targets and exceeding them. This is what's most important. Like I don't. Well, you may have a different view. I bang on about a few things a lot because they're really important, and getting vaccinated is just it is everything. It is everything. 1% of those people in hospital have had a double dose. I don't know that they've got underlying conditions. My sense would be that there's perhaps something else going on there. But even at 1%, what that tells you is that the vast, vast majority of people who are double dosed, they're not going to finish up in hospital gravely, gravely ill.
But what does the backward step look like? You're saying that we could have to take a backward step.
Well, I think it's more. I think what is perhaps more likely. I don't want this to be the case. I'm not forecasting it. I'm just being frank with you because you've asked me a very important question. Like, there could be a part of this where the number of presentations in our hospital mean that we have to pause, and something that was going to happen on date X happens a week later, for instance. That's like one example. If we can calibrate it as good as that, if that's where this thing lands, then that'll be a credit to the people of Victoria, because they will have gone and got vaccinated. They will be following the rules. Their businesses will be COVID safe. You know, I expect if you asked the Premier of New South Wales the same question, she couldn't rule out pausing somewhere, I'm sure.
But can you rule out lockdowns?
Correct.
Because that
Yes, no.
from
Well, the national plan. Yeah, the national plan. You see the national plan working in the very difficult decisions we've made in Ballarat, in Geelong, in Surf Coast and Mitchell Shire. The national plan, after 80%, talks about targeted, localised lockdowns. I'm going to do everything I possibly can, and I've been very consistent about this. Very consistent since I came back from leave, very consistent. I'm not locking down the whole of Melbourne to protect people who, by that stage, will have chosen not to protect themselves. That is disproportionate. So this is coming. A very difficult time in our hospital system is coming. We are opening up. This is a roadmap to deliver the national plan. It is not a roadmap to stay shut. That means if you're not vaccinated, then you're going to be at much higher risk, much higher risk than somebody who is. Why would you take that risk?
Is it right?
Why would you?
According to that roadmap, so you're saying that people who are unvaccinated are essentially going to not be able to go to weddings, funerals, get married, anything like that, come
Yeah.
that 80% double dose target?
Well, on getting married, I'm not entirely sure whether that's what we're saying. I think we're certainly talking about a gathering to celebrate the marriage of two people. I'm happy to have the Chief Health Officer come back on whether we're going quite that far. What we are saying, essentially, if you want to gather in a group of any size, particularly if it's indoors, then you need to be double vaxxed. That's the safest thing to do. If you want maximum freedom, then play the smallest part in putting somebody else in hospital. That's the message. Right? Play no part. Get vaccinated. Do not contribute to the spreading of this virus. Don't make the work of our nurses harder. Don't yourself finish up in hospital. Because this is going to be it already is. It's a pandemic of the unvaccinated. That's a big group right now. It's about to become a very small group, but we're closed now. We're about to be open, and that means the virus will run, and that means many people who are unvaccinated will become very, very sick. It's every reason to get vaccinated, to go to the pub, to not go to the intensive care unit, to see your friends, to be part of the economy, to be back at work, and to not make the work of our nurses harder. Get vaccinated. So important.
Premier, at 70% it says retail will open for outdoor service. What does that mean?
It means that the economy functions predominantly outdoors. Now that'll work for some retail, for other retail it won't. It'll be up to individual businesses. We'll have more to say about economic support. We're not going to turn off economic support to those businesses across the board because some of them, for instance, retail won't work outside. But we've seen some incredibly creative things done for hospo, and I think there'll be some equally creative things done that are COVID safe and are not inside, they are outside. But I fully accept not every retail business will be able to take even a portion of their trade outside. They won't open at 70. They'll open at 80. That's why all of us need to get to 80 as fast as we can, so that those businesses, in fact, everything can be open with rules, but nothing pretty well is shut once we get to 80.
Considering removing the curfew for Metro Melbourne, considering the lockdowns in regional areas aren't having that curfew.
Yeah, curfew and lockdown in Melbourne are synonymous, although we review these things
Could it be removed for next weekend so people could gather outside in parks to watch perhaps the grand final?
Well, Rich, I'm not here to make any announcements about the curfew or the grand final, but we review things every day, every single day. And they're not always reviewed in the negative. Sometimes they're reviewed in the positive. Like Ballarat's numbers are good. Ballarat is strong. They've got only a couple of extras. We've just got to see that trend continue. But I want to have that lockdown off as soon as we can. So we review everything every day.
I guess on that point, with another 5 weeks of effective lockdown in Melbourne,
yes.
Are you concerned about?
Well, could be earlier if we get to 70%.
On the documents
if
we're discussing
doses
today,
turn up, if there's no problem with the orders, then and everyone comes out and makes an appointment, it could be earlier.
Are you concerned though about another 5 weeks? What it does to people's mental health, their hope. You talk a lot about hope, and also compliance. Are you concerned that people are just going to be fed up?
I'm not discounting mental health consequences of this at all, right? But let's be very clear about this. The notion that, let's because of a range of other factors that aren't strictly public health, right? They're not about the virus as such. Let's just let it all off now, or start the process at 45% double dose, not 70%. Well, that's not the national plan. And frankly, I wouldn't stand here and ask the Prime Minister to help pay for that, because it will be catastrophic in many, many different ways. It's deeply frustrating that we are having these conversations and we're still not at these vaccination targets. I don't want to go back over that. That doesn't necessarily serve anybody's purposes, right? As I spoke with the Prime Minister before I came in to talk to you guys, we both agreed that we have to be on the same page. You all have to work together. That is part of that unity is powerful. It absolutely matters. So I'm not going to go back over that. And we can't change what vaccine was ordered when and all that sort of stuff. None of that can be changed, right? All we've got to do, let's get as many jabs into as many arms as fast as possible. Astra's there and it's plentiful. Moderna's coming on this week. Don't wait. Book today. There's thousands of appointments. As we stand here right now, there's thousands of appointments. That means we can bring some of these dates forward, and all of the very legitimate concerns you raised, Rich, about a range of things, about businesses failing, about stress in families, about mental health issues, about all of those things and more. We can deal with those in a positive sense by being open sooner. The other thing, though, let's not for a moment underestimate just how mentally damaging having literally the health system overrun, because that's what would happen if we did it now. We'd have a couple of days of happiness because we're open, it's terrific, and then we would have essentially said to all of our health workers, well, you look after it now because we can't anymore. And it would just be horrendous. It would be unrecognisable. It wouldn't look like an Australian hospital. It looks like something very, very different and real fast too.
Just quickly on schools. Sorry, Julia.
Schools and then mental health, yes.
Schools. Kids are they're returning, but only for a few days a week.
Yes.
They've lost almost 2 years in
Yes.
school. What's being done to sort of help kids catch up? The tutoring program's ending at the end of the year. Will you expand that and also go above and beyond what that tutoring program was doing?
The answer is yes and yes. The details of which I'll leave it to the Deputy Premier to announce. But tutors are here to stay. I've met a number of them, and I've met when schools were open. I visited a number of schools and sat with students and tutors. That's a fantastic program. It's working really well. I think New South Wales has basically copied that program. Good on them. That's here for the foreseeable future. The Treasurer may have a few about that, but he'll be very supportive because he knows that the dividend is massive. Dividend's huge. We've got to catch our kids up, but I'll have some other very innovative and creative things to announce as well about how we support our kids, making up for all the things that they've missed out on. But today isn't the day for that.
On mental health, why are we not better prioritising uniting the country for Christmas, given that a lot of people have been separated from families for the majority of this year due to lockdowns?
Look, again, the way these press conferences work, you can ask me any question you want, right? That's your job. That's your job. And in some respects, your job is harder than mine because you are reporting into a national network, a network that has a program for the whole country. I'm not here doing programming for the whole country. I'm here doing programming and hard work for Victoria. So I just again say this to you, and you may find fault with this, or whoever wants to run this at your network or any network may find fault with this. Getting people to travel between Sydney and Melbourne is not at the top of my list. It's not. I long for the day when that is the most important thing for me to consider. That day is some way off. Some way off.
Do you recognise that that's not just travel, it's not for a holiday, it's actually to see family?
Yeah, you've just said that it's... I understood the question. I heard the question.
Why don't we have more clarity?
I heard the question. You said, why aren't we prioritising uniting people at Christmas time? I understand the question. We're going to do our best to try and do that. I can't stand here and guarantee it because it might not be safe. I've got family in other states as well. Like, you know, we're all Aussies and we should be able to move freely, and we'll get to that point, with the exception perhaps of WA. But I long for the day when that issue is the number one issue I have to deal with. That day is some way off.
System capacity.
Yes. Schools, wasn't it?
Maybe protest is probably shorter. No, that's fine. Go ahead.
On the protest, yes.
You don't have to haggle on who's got the shortest question or answer. I've never left one of these without.
May as well be longer.
We're just having a conversation about all sorts of things.
On the protests yesterday, your reaction to some of the scenes that we saw out there, and are you able to put any kind of estimate on how much that police response cost the state?
I wouldn't see it as a cost. I think whenever you invest in community safety, it's just that. It's an investment in keeping people safe. So police are there to do that job. They did an outstanding job. I thank them, all of them, and I thank their families, who would have been a very anxious day for police families across our state yesterday, to see so many members deployed in potentially very dangerous circumstances. Some have finished up in hospital. I send my best wishes to them. I haven't had a chance today to speak with the Chief Commissioner, but I'll probably speak with him this evening just to see what the aftermath of that was. But I think police did us proud yesterday. No one has the right to selfishly put somebody else in hospital, whether it's through spreading the coronavirus or violently bashing a member of Victoria Police. No one has that right. That is unlawful. Police did a fantastic job. I just say to people again, look, this is not a popularity contest, it's a pandemic, and protests don't work against this virus. They just don't. Otherwise, we could all have had many protests and we wouldn't be here talking about the Delta variant, would we? It doesn't work. It's science. Getting angry about it doesn't work.
This health system capacity through the roadmap document says that you're, I guess, deploying alternative workforces for the COVID-19 functions, vaccination and testing.
Yep.
Are you able to let us know how many clinical staff will be returned back to hospitals, and I guess how much would that...
I can certainly come back to you, yes. I don't think I've got that in... And again, some of that's to be determined as well, but the aim... Again, it's greatest good for the greatest number, best use of the best skills, right? So having a nurse administering a vaccine, which somebody else can do while we've got EDs full and people needing to be admitted into beds, the nurse will go back to the hospital and we'll find somebody else to do the vaccination. That'll be done safely, but it'll be, you've got to allocate and get the best use out of everybody based on their skills. So yes, there will be an answer to exactly that question, or at least an estimate. I'm happy to try and get it for you.
In April, you said that there were currently 450 ICU beds in Victoria. This was in April 2020.
Yep.
You announced $1.3 billion to secure ICU equipment, staff and space, and essentially establish an extra 4,000 beds.
Yep.
Have they been established yet? And when do you expect to be able to establish those 4,000 beds? Because if you sort of let me finish.
Yeah, sure.
The COVID Safe Common Operating Picture that obviously collects the national database said that we have currently 429 ICU beds available in Victoria this week.
Yep.
13% of those were filled by COVID patients.
Yes.
August last year, so at the height of our second wave, we had 454 beds, so essentially more ICU beds last year, when only 6% of those were filled by COVID patients.
Yep.
So when are we getting to 4,000 ICU beds, and why haven't we increased the ICU bed capacity yet, and we've essentially gone backwards?
No, well, I wouldn't accept the last part of your question, and I'm not sure whether you're doing today, this year, compared to today last year, or whether you're doing winter to spring.
No,
it's year on year?
Yes, year on year.
That's fine. What I would say to you is this. Having 4,000 ICU beds with patients in them is not what success looks like. It's far from that. It's far from that. It's to be avoided, because it's something that we have 4,000 ventilators, right? We've probably got the staff to do it, but let's be clear, it's not last year. They've worked their guts out for every day between last year and now. So people are tired. People are fatigued. The notion that this year with Delta, is the same as last year before Delta, very, very different. Very different. We have capacity to flex up. We have machines. We have all of that equipment. But it's not just ICU beds. It's beds more broadly. It's the number of patients who are admitted. On the issue of why haven't we got them, look, there's not. Well, they'll be expanded as they're needed. Like, the last thing we would do is go and have, like, literally send everybody else home out of beds. You're discharged. You're going home because we're going to have this bed set up as an ICU bed in the hope that someone's going to fill it. 4,000 ICU beds is not what success looks like. It's very different. It is a health system that no Australian would recognise as being an Australian health system. They would look to other parts of the world and they would say, that looks like all those health systems I'm glad I'm not in. If we had 4,000 patients in ICU, no one in this room wants one of their relatives in one of those beds, because that's going to be really, really hard.
I don't think there is a single person who'd disagree with that assessment.
Oh, but there are some out there. There's been questions in the Parliament this week about, where are the 4,000 beds? Why aren't they all open today? Like, we were sitting there with nurses waiting at the foot of the bed, waiting for a patient to arrive. Like, that's not how it works. We grow the system as the demand grows, as the need grows.
So that's my question, essentially. Are we able to grow up to 4,000 beds? Because at the time last year, you essentially said 450 fully equipped and staffed ICU beds.
Yep.
So it was part of that $1.3 billion boost. It wasn't just for ventilation or PPE or beds. It was also for staff. So essentially, do we have enough staff and equipment to hopefully...
Well, we certainly have enough equipment, because equipment is basically static, right? You've either got the machine or you haven't, right? So that we've got the equipment. On the question of do we have the staff, it'll depend what I've asked them to do in the weeks and months before we get to anything like that number. That's the basic answer. I spent a lot of time last year talking to a lot of nurses, doing Zoom calls, just giving them, not talking, really listening, giving them a chance to tell their stories. I've referred to this before. And they talked about, incredibly difficult and challenging, very, very difficult for them. It will be even harder this year. We will flex up, expand, grow the system as fast as we can to provide every patient with the best care possible. But having the machines in the shed, as it were, in the warehouse, that's one thing. But machines don't treat patients. People treat patients. And I don't know. I genuinely can't be certain. None of us can. Not here, not in New South Wales, not in any part of the country, that we would, for any sustained period of time, have that many ICU nurses. You couldn't be certain of that. In fact, you can be almost certain that that would not be sustainable.
So
the other thing too is that there were a lot of things we didn't know last year. Like, we were planning and we bought every ventilator we could get for the worst. That's before anyone was vaccinated. Now we're going to have 80% of people with double dose. So that is a position and an outcome to be avoided. That's not what we're aiming for. And I would never open hundreds and hundreds and hundreds of ICU beds unless I had patients to fill them, because that's resources that are diverted away from other patients.
what can we flex up to, though? What can we logistically and realistically as well scale up
Well,
to?
look at the table you've got there, and it's not just about ICU. The table talks about 2,500 COVID patients. So that means that's 2,500 beds that are, plus a whole lot of other COVID patients who'd be outside the system. That's displaced a whole lot of other people. Heart, stroke, cancer, whatever it might be, right? So lots of impacts. There's not much elective surgery going on other than Category 1, and it's probably been moved to the private system. Again, these are things to be avoided, but it's appropriate to have, as the Secretary, as Professor Wallace calls them, guardrails or safety valves, or whatever you want to call it. That's important. That's important. Let's hope we don't get to that point. But there should be no suggestion, and none of you ought to take seriously anyone who suggests to you that, we haven't appropriately resourced the health system. We absolutely have. Anyone who suggests that really doesn't know what they're talking about.
And just finally on this point...
But 4,000 ICU beds down at the exhibition centre, is not what success looks like.
350 extra nurses. Sorry, can I just finish up on this point? You had announced about 350 nurses to come down from Ireland, I believe.
Yes.
To drop in the healthcare system.
There's a bunch of those that are in quarantine, I think. I'm not sure where they're at, but if your question is, can I get you an update? I absolutely can.
I mean, just on a reflection, we do always look to overseas jurisdictions to see the worst of things. But when you look at a jurisdiction like Denmark, which is what, 6 million people, a third of the size of what we are,
Yep.
they've had 500, maybe 2,000 deaths in the last 2 years, and they've had, other than the initial lockdown, there's no lockdown now. There's 80% vaccinated. I get that, but there's zero control after the 80%
Yeah,
vaccinated. There's
but that is what success looks like. So I'm not for a moment when I talk about an unrecognisable health system. I'm not disparaging, every country around the world. Like people. Anyway, I'm not here to comment other than to say I think that we could get to a situation if we didn't do this cautious approach. If we didn't do that, and necessarily kind of disappoint some people who'd like to be open faster, I get that. Then we would have a health system, a hospital system. You'd walk in and you wouldn't recognise it.
What I'm suggesting is, though, that they haven't had 240 days of rolling lockdowns, though, like we have in Denmark.
Yeah, I think they probably got to... Well, look, I'll boldly predict for you as well. If at the end of last year, 80% of us had been double dosed, there would have been no lockdowns this year. Like, not one. I don't order the vaccines. I'm not responsible for that. What I was responsible was for vaccinating 25% of Victorians. We're currently vaccinating 50% of Victorians. I'm proud of the work we're doing, but let's not revisit all that and go back on stuff that none of us can change. It is the history. It's in the past. Let's get those appointments filled today and every day until we get to 80, and then I'll be up here talking about trying to get to. It won't be pegged to the national plan. Let's be clear. We'll do all the stuff at 80, but I'll be up here banging on about getting to 85. Or 90, or whatever we can get to.
Is this 80%? Is this 80% for kids over the age of 12 going to be part of the national plan, or have we gone that? Is that just a state-based thing?
Well, I had this very discussion with the Prime Minister early on. I think that we are nationally at 13% first dose for 12 to 15-year-olds. It's only been open a short time. I think we're going to smash that number. Obviously, parents and young people want to get vaccinated, and it's if you like, it is an extra, but it comes after we've already delivered on all the things that we had committed to deliver. But it just makes sense at that point. I think that there's no, like, why would you put the asterisk on the 80 if they're all vaccinated at 80%? Let's include them in the 80%, and then hopefully the conversation can turn to whether there's a kids vaccine next year.
I understand the aspiration, of course. So I'm just wondering why rules are tied to it if it's not part of the national plan.
Well, we're going to get 12. Well, the thing is this. Approval for 12-year-olds to 15, 12, 13, 14, 15-year-olds came after. It's come after the national plan was first settled, I think. It's certainly more recent than when the national plan discussions. I don't think it's incompatible at all. I think we're splitting hairs, to be honest. It will add hardly any time. In fact, it may add no time at all, given that it's only been open a couple of weeks, and they're already, the Prime Minister tells me, and he'd have the national data probably better than me, we're already at 13% single dose.
We get this modelling is planned on everyone isolating for 14 days if there's a case. If there's a case in a year 12 exam, does everyone have to go home, or is it just that? Is it the whole school that goes home?
Yeah, it's probably best if it's best if we just spend some time considering that. Some of that is being worked on right now. We don't necessarily have answers to all of those questions right now. So what does contact tracing look like post 80%? What does close contacts and the different rings of close contacts look like post 70, post 80? Their discussions, I think, will probably be taken to throughout the course of this week. We'll give parents and students and teachers as much notice as we can.
How many people need to be vaccinated for seated service to no longer be required and for people to be able to dance at a nightclub?
It's a very good question. I can't answer that now. I will be able to answer that as we see more real data, and we're no longer dealing with kind of assumptions and guessing. We've got real hard data and actual experience to base that on. I want to try and get everything open. By 80%, I want nothing closed. There can be rules, there can be limits, but the place is open. And then progressively we'll take further steps beyond that. And I fairly concede that some of the activity you've referenced won't be able to happen.
I know last questions have been pulled, so...
A few times, but I'm fine, it's all right.
A few times, yes. We're hearing that...
You do have to file at some point, don't you? Got a 4 o'clock bulletin anyway, yes.
Sorry, guys.
These guys just want a question, but anyway.
Well, I don't know.
No, Brett says he wants to go home more than he wants a question. That's what the record will show.
We're hearing that employees in regional Victoria have had their COVID-19 disaster payment applications rejected. Has the state stopped subsidising those payments
No.
in regional Victoria?
No, I want to be very clear about this, and it's not a good note to end on, so hopefully there's at least one more question that I can briefly answer so we can finish on a positive. They were cut off by the feds. I don't know why that happened. We pick up the tab, but they send us the bill. The Commonwealth administer it, for this is for non-hotspot disaster payment workers, right, who've lost the relevant number of hours. Lots of regional Victoria, that is open. We pay the bill, so we pay the Commonwealth back, if you like. I don't know why they did that. So it was they were cut off, and then it moved to, which I was pleased about, that they had to reapply. I don't know why they have to reapply. The Commonwealth government are the best people to talk to then. But we've done nothing to bring that about. In fact, we're waiting for the bill. When the bill comes, we'll reimburse the Commonwealth.
And will business support continue beyond September 30?
If it needs to, and I think that as we've now got more certainty for people, so what will be open, what won't be, and the degree to which it'll be open, you'll see Minister Pakula and the Treasurer out making further announcements as soon as we can to give people that sense of absolute certainty, as certain as you can be in the midst of a global pandemic.
Quick question for Brett.
Absolutely. No more for me. Thank you so much.